Hi, everyone. Welcome and thank you for joining the Williams Institute for a discussion about Indigenous LGBTQ plus people, disparities in data justice. Now I'm excited to introduce Bianca Wilson, Senior Public Policy Scholar at the Williams Institute. Welcome, Bianca.
Thank you, Carly. Good afternoon, everyone, or whatever time zone you are zooming in from. Today is actually our second webinar panel in a series highlighting the work of the Williams Institute as part of our 2022 Annual Update Conference Week. Please see our website for information, both on yesterday's panel on the intersections of race, SOGI, and asylum status, and then also for information on how to register for tomorrow's panel on the shared interests and threats to LGBTQ rights, reproductive rights, and critical race theory. I want to note here that as a land-grant institution, the Williams Institute at UCLA acknowledges the Gabrielino and Tongva peoples as the traditional land caretakers of the land on which I am calling in from. So today I am pleased to present and then moderate a panel on policy and data equity issues related to American Indian LGBTQ plus people. In the last year, my colleagues at the Williams Institute and I have released a series of reports highlighting the role of LGBT status in the health and well-being of several racialized groups in the US. And then finally, the last report, which came out in January, reported on the role of race among LGBT people with regard to economic and health outcomes. American Indian and Alaska Native peoples were among the racialized groups that we highlighted in this series. And so the aim of the panel today is to present a little bit of data on the health and well-being of those who identify as both AIAN and LGBT, then to discuss the relevance of these data for the ongoing work of my colleagues here, and highlight needs for new and better work that supports the intersection of Indigenous, sexual, and gender minority statuses in the land currently labeled as the United States. So we'll all give some comments. I'll present a little data, we'll all give some comments, and then we'll have time for Q&A at the end. And please remember to use the Q&A function in the meantime, and then we'll get to those questions. So before we kind of go on to the main content, I'd like to invite my colleagues to introduce themselves. They'll provide names, where they're calling in from, and a little bit about the work that they do. So to get us started, Kori.
Good morning, everyone. My name is Cordero. I am calling in from Wiyat territory, about 400 miles north of the Williams Institute. My pronouns are they, them, theirs. I currently am a licensed attorney with California. I work for the Yurok tribe. I've been working in the federal Indian law and tribal law context for a while now, since graduation. I am Native. I'm not an enrolled member, but I'm a descendant. And I don't focus squarely on queer issues, but I do that in terms of my bar association work, just part of my identity. And I always try to sort of work at the intersections of tribal law and queer rights.
Great, thank you. Soma.
Hello everyone, my name is Somah Toya Holland. I am a queer, non-binary, gender fluid person. I use they, them pronouns. I am Turquoise Clan from the Pueblos of Laguna and Jemez in so-called New Mexico. And I am joining the webinar today from my apartment in Brooklyn, New York, where I'm living as a guest on occupied Muncie, Lenape, and Canarsie land. I am a media organizer for Pueblo Action Alliance, which is a community-driven organization that promotes cultural sustainability and community defense by addressing environmental and social impacts on Indigenous communities. I would like to say thank you to Bianca for inviting me to be a part of this panel and just for being wonderful. And yeah, thank you all for sharing space with me today.
Yes, thank you so much for joining us. And Karina. Oh, you're on mute, Karina.
Alito sa Hachifa Karina Walters, Mija, Oklahoma Chatazia. Good morning, afternoon, everybody. I'm Karina Walters. I'm enrolled in the Choctaw Nation of Oklahoma. I am coming to you from Tongva lands here in Los Angeles. I'm visiting one of my relatives here, my father. I currently am a professor at the University of Washington School of Social Work, where I co-direct the Indigenous Wellness Research Institute. Our institute is dedicated to focusing on developing and designing culturally derived interventions and research in partnership with tribal communities, utilizing indigenous methods and methodologies and decolonizing approaches to the work that we engage in around chronic disease prevention. A big study that we conducted and that I was the PI of was the Honor Project, which was a 6-site national study on LGBT, TwoSpirit, queer, Indigenous people, Native people across the country. And so I'll be kind of referencing that a little bit today. And I myself prefer the term, I'm okay with the term TwoSpirit. I would prefer my own tribal term, but we're still figuring out what that is in the Choctaw world. My pronouns, she, her, they. And that's it. Yep, glad to be here. Okay.
That's great, thank you. And again, welcome to all of you. I'm really looking forward to today's discussion. I'm going to actually start with a presentation of a little data. We'll go ahead and put some slides up. Thank you, Carly. So to get our panel discussion started, I'm going to provide an overview of some of the findings from our reports that I noted earlier. Next slide. So I want to first acknowledge that research on Indigenous peoples along the lines of sexual and gender diversity happens in a very specific, unique political context. Claims to represent American Indian and Alaska Native people through data collection must wrestle with the historical use of data to oppress Indigenous peoples here in the US, both through ways that inclusion and exclusion. So the ways structural racism has played out has included externally defining who does and does not count as Native, what counts as data, who controls the data that are collected, and whether capacity to manage and analyze data exists in Native communities. So, with that as background for how we think about the data that we'll present today and talk about the issues that we talk about today, one thing that we do know, though, is that when we look at those data sources that do present, that do measure American Indian identities, and this is whether it's US federal government health surveillance efforts, tribal health surveillance efforts, or community-based projects, when we look at the data that are actually collected, we see consistently that there are health and economic disparities experienced by American Indian, Alaska Native people. And then, it is challenging, even knowing that those data sets exist, to find those that are large enough to examine how American Indian identity intersects with other social statuses, such as sexual and gender identity. And this is the case in both US government and tribal government-led data efforts. So in the report that the reports that I'll highlight today, which were completed by my colleagues, Elle Boughton, Christy Mallory, and Suni Choi and I, and really extending the work of Jessica Elm and Kareth Conran, we turned to a few population-based data sets that did ask questions about race and sexual identities and gender identity, allowing us for both an analysis of AIN peoples across LGBT status and also across LGBT people to understand how race matters. Next slide, please. So estimates at the time that the primary data source that I'm presenting on today were collected through the Gallup Daily Tracking Poll indicated at that time that there were nearly 300,000 AIN LGBT identified people in the US. So here I want to highlight that the way this was measured is folks were asked whether or not they identify as LGBT as a collective. So these are people who claim the term LGBT status and TwoSpirit was not included in that list or as an option. And people were allowed to select either that they identified as American Indian / Alaska Native only, or that along with other racialized identities. And among the people in the sample, those other racialized identities included primarily both white and Black, but also Latinx. And, you know, we see here, just looking at the map, whether identified only as American Indian, Alaska Native, or, you know, American Indian and other racialized groups, LGBT Indigenous people are most represented in the South and the West, but still living in all areas that non-LGBT Native people are living. I mean, very similar to what we see among most people of color in the US, among queer folks. They haven't all hit the road to San Francisco and New York. They essentially live where other people of color, regardless of LGBT status, live. Okay, next slide. So when looking at how LGBT status matters among American Indian, Alaska Native people, and I'll take the area of economics first, there are a few main takeaways. So here, I'll highlight that among those that are only identified as American Indian, Alaska Native, low income rates are high, and they're high regardless of whether people identify as LGBT. However, we do see a slightly different pattern when looking at multiracial American Indian, Alaska Native women, where you do see some LGBT differences. And then moving, and I'm just highlighting a few of the main outcome areas so that, and we'll cover a lot more of this in our discussion. So when moving to health, next slide. A similar pattern here is revealed when asking respondents about how they rate their overall health. And here the percentages, the values that are presented here are what percentage rate their health as fair or poor. Again, you see essentially a lack of LGBT significance, particularly for those who are only identified as American Indian, Alaska Native, and then a slightly different pattern again, where you see an LGBT difference for multiracial Indigenous identified women who are LGBT. Okay, next slide. So, however, when asking about depression, the pattern is different. Depression rates are high among all American Indian groups, but most high among LGBT people. So, and this is regardless now of whether folks are multiracial or monoracially identified. So, assessing LGBT status differences among American Indian, Alaska Native people is one way to examine how race and LGBT status intersect. But we also looked at how race was related to outcomes among LGBT people. So thinking about it really in the other direction. I'll show a few charts here, next slide. And for more of these across race comparisons for both Indigenous, LGBT identified folks and other racialized groups, please see our data interactive on the website. I think Rachel already posted the link for it. So here you see in terms of economic outcomes, American Indian, Alaska Native, LGBT people show similarly high or higher low income, unemployment, food insecurity. You can see AIN folks are the last two bars at the bottom. Again, both multiracial and monoracially identified. So again, looks similarly high or even higher in terms of economic disparities compared to the other LGBT people of color, and far worse outcomes in the white LGBT people. And then moving to the next slide. These racialized disparities are even steeper when looking at health outcomes for American Indian, Alaska Native LGBT people compared to all the other groups. So here in this graph, you see on the left, again, that reporting of fair or poor health. And then on the right, those reporting having experienced depression and see very high rates. So when thinking of the racialized disparities among LGBT people, we see very high rates for American Indian, Alaska Native people from this report. So final slide in the data overview. Okay, so after all those data points on negative outcomes, I want to highlight at least a few areas of potential resources to consider in planning for how to support resilience and resistance. Here we use data from the NIH-funded Generations and Transpop studies, which focus specifically on LGBTQ plus adults. Here we see that from a third to a half of LGBT, American Indian, Alaska Native adults indicate that they felt connected to LGBT communities. Only about a third reported a strong connection to American Indian communities, but a caveat I want to give here is that this study, those who identified as American Indian or Alaska Native were primarily multiracial, and we do know from other research, such as at the Pew Center, that multiracially identified American Indian folks do tend to have lower ratings of connections to Native land and community. So my guess is that's some of what's going on here. And then also note, though, about 75% do indicate that they feel that they have a strong sense of social support in their network. So with that, we're going to take down the slides and move to the panel discussion. That's a little bit of our work. So I'm gonna start with Soma and ask, tell us about how your work, your experiences informed by data like the findings I just highlighted.
All right, hello. So like I said before, I'm from the Pueblos of Laguna and Jemez. There are 19 Pueblos across so-called New Mexico. And the Pueblo Revolt of 1680 was actually, it eradicated Spanish colonizers from our communities and was the first and only successful uprising by Indigenous people in so-called North America. And so at Pueblo Action Alliance, where I work, we carry that revolutionary spirit through all of our grassroots organizing work. So at PAA, we try to make, our spaces are made by and for Pueblo people. We organize on Southern Tiwa territory in so-called Albuquerque. Through events that we host and through our social media presence, I feel like we want to make space for Pueblo kin. Some of our goals are to offer representation, build community, share information, and provide support to Pueblo communities. And this includes urban Native folks. This includes displaced Pueblo folks. We really try to make space for everyone to foster that connection that we were talking about earlier. So we have core values that reflect our teachings as Pueblo people. And we recognize that some of the structures on our reservations are still influenced by the Eurocentric mindset that Spanish colonizers brought with them, and that things like the gender binary are a tool of oppression and assimilation. So by creating this space and facilitating things like book clubs, workshops, and healing circles, we are intentionally inclusive to folks that may feel like they don't belong, or that may feel like they don't belong in other Pueblo spaces, or those that feel pushed out to the fringes, as Pamela Jumper-Thurman stated in the NBC article on this study. Mm-hmm. So in terms of the way that we work at PAA, we are a matriarch, femme, two-spirit-led organization, which is different than our Pueblo governments at home that are led by men. And although a portion of our staff are queer or gender non-conforming, something that I've noticed in our working spaces is that we all kind of use they, them pronouns for each other interchangeably, which I feel like has just kind of naturally helped to eradicate the gender binary in our working space. So I'm going to speak a little from personal experience as well. I just feel really grateful to be a part of this organization because it's the first time in my life that I've felt like I've been able to bring my full self into a space and not feel like I had to check my queerness or my indigeneity at the door. My mother and I moved a lot when I was very young, and I was constantly oscillating between our res at Laguna and various parts of Albuquerque in California. So although I'm known by my family and my community at home, I still have days where I don't feel Pueblo enough, right? I fall in that multiracial category. So But I also feel like it was moving so much when I was young, and being exposed to so many different environments that I believe helped me to discover and embrace my queerness in a way that I may not have been able to otherwise. So I'm grateful for those experiences because they gave me the agency to really discover myself. I got really good at code switching and blending in, even when I didn't necessarily want to. But as an adult, these experiences sometimes made me feel really alienated from my Indigenous peers, especially when I was in college, because as a mixed person, I'm often not recognized by other Indigenous people that I see out in the world. And so I believe that for a lot of queer Indigenous folks, this heavy depression is often caused by that feeling of being lost or not being seen by our peers. When so much erasure exists both towards the LGBTQ community and towards the Indigenous community, it can feel incredibly isolating when those are the two main ways that you identify. So our work at PAA, at Pueblo Action Alliance, is informed by this data, in that we are working to address the root causes of these findings by acknowledging how colonialism is persistently and deeply affecting our lives still today. Part of our vision states we have the right to our own Indigenous self-determination and sovereignty, and ability to create communities and economies that meet the needs of our Pueblo people. For us, this means all Pueblo people. We do not see through the colonial lens that makes people across the LGBTQ spectrum feel othered in many spaces. And I think that through our presence on social media and in other spaces, I hope to keep sharing this perspective and be an example to our Pueblo kin who are maybe straight or cisgender, to call them in and remind folks that the tools that are used to oppress LGBTQ folks are the same tools that were used to oppress our ancestors and assimilate us into whiteness. So we cannot heal our ancestral trauma if we don't bring everyone with us. And in terms of areas of service, we need more accessible healthcare in the first place. When the COVID-19 pandemic hit in 2020, rural Indigenous communities were hit the hardest. I know that like the Navajo Nation especially was highlighted for just having a really high rate of sickness and death. And I can't speak for everyone, but definitely in the Southwest, we often have many people living with multiple generations in one household. And there are very few accessible hospitals. So when the pandemic hit, many were not equipped to care for all the people that needed it. So now imagine being a trans person and living in a rural community and trying to gain access to gender affirming healthcare. You'd probably have little to no options that are both affordable and safe. So we need to make sure that if these services are not available on reservations or through Indian Health Service, that our trans relatives are getting the resources that they need. This is just one example, but affirming healthcare, just like having a safe space to simply be, is suicide prevention. Giving people the tools to feel confident being themselves and not having to shrink themselves to be employable is suicide prevention. Providing mental health resources, regardless of enrollment status or being located on or off the res, is suicide prevention. And it is paramount to remember that mental health problems like depression are not caused by being queer. They are caused by trying to fit into spaces that don't embrace your queerness. So in order to make policy change effective, we also need to change the culture and get everyone on the same page. So that's a little bit of the work that I think we're trying to do at PAA. Thank you.
Yeah, thank you so much. I can see there's several people in the audience that are thinking the way I'm thinking, just like, yes. So appreciate your insights and thank you for sharing them. I'm gonna move to Karina, who, has engaged in research and data advocacy in this area for many years, and would like to hear your thoughts on, what you think the data are telling us and what you think you've seen differently too.
Well, thank you, Bianca. Well, first of all, I'm really glad to see that we're trying to get more information, and that helps us increase our visibility and be able to identify where the gaps are and where the needs are. But also, I was glad to see something on resilience as well. And I really want to emphasize the importance of focusing on the thrivance and the strengths of our communities and how well we're actually doing despite settler colonialism and all the other kinds of traumatic exposures that we are exposed to over the generations and contemporarily. I was struck by something with the data that I just wanted to kind of highlight, which is, the sampling method. The Gallup sampling poll is, I know, a classic method, but I could tell you that we're definitely not accessing some of the more rural reservation-based communities, as well as urban Native folks who don't have access or phone lines or cell phones. And when we did the honor project, one of the things that we did is we knew that was going to be a big barrier because a fair amount of our community does not have access to that technology, and everything for all kinds of reasons, from just not having the income to be able to afford something like that, or just not getting access to wireless and other kinds of opportunities in the communities where they reside. So one of the things that we thought was really important is really doing targeted sampling to really identify American Indian, Alaska Native, Two-Spirit folks. And we also did respondent-driven sampling. So we basically asked people to identify people in their networks who were Two-Spirit, LGBTQ, queer folks that they felt comfortable enough reaching out to, whether by mail or in person or by phone. So we're reaching out, and we randomly sampled from within people's networks, and that's how we created our national sample. And because we did that kind of outreach, and also because we actually engaged at the Seattle site in more like census-based sampling, so basically tracking down anybody that we could find that was Two-Spirit to participate, we also were able to access people who are not in stable housing. So these are folks in our community that have really also high needs for support. Outreach to especially younger people who are on the streets because they've been kicked out of their communities or kicked out of their homes, things like that. We did not want to miss our voices. Settler colonialism is designed to erase and replace with narratives of dominance and other kinds of things, and pathology and things like that for our communities. So I think it's really critical that we find sampling methodologies and approaches that really elevate the voices of the diversity of our communities and ensure that we're at the table, our voices at the table as policies and decisions are made about resources to our communities. So that's really critical. So some of the standouts for me that made that may have been partly a sampling difference is the income level and unemployment in this sample. Although I know it's still appalling that we see the high rates of low income in a sample. I know from our honor project study, because of our sampling approach, we had 59% of our sample was unemployed, despite being highly educated. Highly educated meaning, over half the sample had a degree higher than a high school degree. So there's something there going on in our communities. The other piece I wanted to acknowledge is that we specifically focused on urban-based sampling. And so, our sample obviously didn't get at all the reservation rural-based communities. And I think there is a really high need to really understand what the lived experience is for our queer, Two-Spirit, LGBTQ folks in reservation and rural communities. The other piece that I thought was really important is, but also sad at the same time, is, when I looked at the comparison for the mental health outcomes for the Gallup poll and our study, 36% of our sample was diagnosed with major depression, and we're not seeing any change 10 years later at 35% in the current sample. So, we need to do something about that. And one thing that wasn't assessed with the current sample is the issues of PTSD. Soma said it really beautifully. We have these issues not because we're queer or Two-Spirit or anything like that, but because we're living with structural racism and, all the way from systematic exclusion from certain kinds of things, all the way down to everyday interpersonal discriminatory events and violence that we're exposed to. I mean, 25% of our sample was in foster care. 38% of our sample had experienced boarding school. So those are the kinds of things that we need to disentangle a little bit and find out what are some of what's driving some of the population health disparities in our communities. How is structural racism driving that? How is settler colonialism and its manifestation in our communities driving some of that? And we need to include more culturally specific measures that get at that. So, how does boarding school experience, how does historical trauma, how does different kinds of intergenerational traumas impact our Two-Spirit communities' wellness and well-being? How does connectedness really matter? And I think you guys did a great job of looking at that as a resilience factor. Again, I think it's a sampling issue that you only had about a third saying that they're really connected to community. I don't think it's necessarily a multiracial thing. I actually think is, at least in our sample, we had a lot of people who are also multiracial, but they were over 80% were strongly connected to their Native communities. So again, I think it's a sampling issue. And so we're obviously, it's a little bit of an uneven voice there that we need to really kind of look at. And for us, we found that people who were more, had a more positive identity as a Native person and were connected better to their communities, that served as a protective factor that buffered against the impact of those kinds of structural violence, microaggressions, different kinds of trauma and violence that we experience. And it buffered the impact on our wellness outcomes. So, being culturally identified, being connected to a community, having family acceptance in community was also a major factor. And then the last thing I want to say is that suicidality, Soma raised that. I mean, that's a major, major factor for our Two-Spirit folks. In our study, we had over 40% of our sample had attempted suicide in their lifetime, very high rates. So that's an area that we still need to see some change and some impact on reducing that. The work we've been doing is looking at things like land-based healing, getting reconnected to positive aspects of our original instructions as Native people, our stories that are held in our families around Two-Spirit people that are positive, that connect to our strengths and well-being. Those kinds of opportunities to restore relational ways of being in the world that are healthful. Those are the kind of interventions that we're looking at trying to develop in partnership with our communities. And let's see, anything else I really wanted to say at this point? I think I'll stop there to make sure we have time to cover other issues. So yeah, okay, thank you.
Yeah, thank you, Karina. And I hope to come back to some of the other things you were thinking you might say, or other things I know need to be said about what is and is not represented in data like that. So for now, I'm going to move to Kori Cordero. Would love to hear your thoughts on how you think your work is informed by data like this, or the absence of the data that you think needs to be there. Yeah.
Thanks. I think going back to that question, your original question, I'll focus a little bit more on the advocacy and policy side of things. But before jumping in, one of my first reactions to the summary that I read and your presentation is I don't feel represented in any of the data reports. It's men, women, American Indian. I'm legally trained, and so as part of my legal training, we know that Indian is a federal definition. It's a political identity. It's not a racial identity. And so the difference between race, like if I check a box that says Native American, that's a racialized identity, versus checking a box that says American Indian feels like a legal political identity that I don't have a claim to due to my own sort of lack of enrollment. So that's just something that I kind of wanted to flag. And I think there are a lot of folks that I know personally that might respond differently to the data and might be hesitant to sort of be included. So that's just kind of one thing I wanted to flag. But in terms of my work and how this kind of data informs some of the work that I do, super boring. It feels most of the time like the least revolutionary way to do anything, but I know it's important and I value my colleagues who do it. So in my context as like an attorney who works within the legal profession, bar associations, trying to make policy and advocacy pushes, Generally speaking, LGBT rights is not a major focus of any of the tribes that I work with. Some of them perhaps, but a lot of this happens sort of outside of that. And I'll use a couple of other reports as an example. So the Indian Law and Order Commission did a report on criminal jurisdiction issues. They basically want to take a look what's happening in Indian country in terms of justice and outcomes. They developed a report. There was a lot of data in there. In my role as a board member for the National Native American Bar Association and an active member of the American Bar Association, we then created resolutions saying, hey, we agree with this data, we agree with the findings in this report and the recommendations. Now that's going to be our policy push. We need to have a VAWA fix. We need to fix this Oliphant jurisdiction. We're looking at how tribes aren't able to respond to violence against women, so we want VAWA. And that became a policy push for NABA. That's something the American Bar Association adopted the whole report as policy. And then the American Bar Association, we were able to use that to speak with one voice to Congress. And I think that was really helpful when it came to passing legislation, having the American Bar Association and the entire profession saying, yes, we want this change for Indian country. So that's one way that we use data. That's happened with, I mean, it's happening now with the missing and murdered Indigenous persons. Another report, which reminds me of some of the things that Dr. Walters was talking about, the American Indian Alaska Native Children Exposed to Violence report. That, I think some of Dr. Walters' work was cited there too. That discussed all of these different exposures that Native children have, American Indian Alaska Native children have, 22% rates PTSD, the same rates as veterans returning from Iraq and Afghanistan, talking about the 34% sexual assault survivor rates, 2.5 times more likely to have attempted to commit suicide or to have successfully completed suicide, which is 3 times more than the regular population. So all of these things are sort of layered into the data already. And so we were able to use some of that information to say, hey, we want to address, okay, we know that there's suicide rates, there's LGBT rates, there seems to be some correlation here. Let's look at conversion therapy. We know that conversion therapy can exacerbate mental health issues for queer kids. And so that became a policy point. So we're able to use the data from that Children Exposed to Violence report, some data from the Williams Institute. I'm sure Dr. Walters and other sort of statisticians would have a lot of qualms about how we sort of made this argument, but it was like, hey, there might be a correlation here. Let's just look at conversion therapy. The American Bar Association and the National Native American Bar Association, some of the work that I did with them, we then put out a report and a guidebook basically saying, hey, this is how you can ban conversion therapy. Look at your tribal laws. These are ways that you can just make simple changes to signal to youth and to families that conversion therapy is a harmful practice. Here's the data to support that. Here are the tools that you need to change the law at the local level. So whenever we see more information from the Williams Institute that is tribal specific, it's really helpful for us. There are a lot of queer folks that are working in the legal profession, like most of the Native people that I work with, most of us identify as queer, sometimes TwoSpirit, sometimes not. And so it tends to be an issue that sort of plays out, I think, in the Bar Association realm right now. And then on the local level, grants is the big thing. So if you do have a community that is concerned that they're acknowledging their queer community within the tribe, they want to get services or resources for these kids, grants is usually one of the big components for funding for tribal governments. Tribal governments don't have a tax base. I work for the Yurok tribe. 95% of our funding is grant funded. So the grant writers and the program managers, they get this information here to say like, hey, we need more health services for our queer students, or for low-income families, we need some housing programs targeted to it. And then we can cite this kind of data as proof that it's not Yurok specific, which is something we'll talk about later. It's not regional specific perhaps, but it's still illustrative of the kinds of problems that this tribe is facing, and this is why we need the money, and it can be really helpful on the local level to have data to cite to. So those are kind of, I think, 3 big areas. There's the policy and legislative push with the bar associations, and then on the local level, just getting the information you need to make grants, or to perhaps even do some policy pushes with the state.
Yes, thank you, Kori. Not boring at all, needed work. So, yeah, I mean, so I think we'll just kind of from here kind of continue really interrogating the data in a way to highlight even more, like what's missing? What issues do we need to be thinking about more, learning more about? And I thought I'd start with you, Karina. You know, I can imagine several things that could go on this list of what else is needed to be talked about. I think in particular, the fact that the data I presented do not include TwoSpirit as an option, that might be, something I think you could comment on, particularly given our work together on the NASEM panel.
Yeah.
Wanted to see if you wanted to provide some comments there.
Yeah, no, thank you. I mean, TwoSpirit's an imperfect phrase and word. It's a placeholder for people. It's not, and some people don't find it relevant for themselves. So I want to acknowledge that. For lack of a better term, I think people, we did found in our honor project study, about a third of the sample consistently just refused to be put into the box of LGBT. And whether it was for sexual orientation or gender identity, they preferred the term TwoSpirit as a placeholder. And it was clear that was a placeholder, or they wrote in their native specific term, how they understand themselves. So that's an important element, that we have our tribally identified terms and ways of understanding both gender identity and expression, as well as sexual expression and identity. And so we would potentially we're losing a sample of people who may be actually more tribally identified potentially if we don't have that more inclusive term, or at least a place where people could write in how they self-identify for a term that's more specific to themselves. So that's that is definitely an issue of something that needs to be included. I would love to see more measures that really tap into how we're doing well and why, and what are some of the strengths of our community, as well as the issue of belonging that Soma had raised earlier as well is huge. Even in our qualitative work, we found that just having one relative, one auntie, one uncle, one grandma, one relative in your extended family and community that sees you, and not only sees you and embraces you, but actually contextualizes who you are in relation to the connectedness of the tribe, the people, the ancestors, those kinds of things, makes all the difference in the world. And so that sense of belonging and creating those kinds of measures that are more culturally relevant to our communities, I think, is really important. Issues around raising issues around identity and not belonging. I think, Kori, you kind of highlighted that, it's not seeing yourself represented in this. That also needs to be addressed and looked at as well. Also, Kori mentioned the issue of trauma and violence in our communities and the issue of MMIWR. I can tell you that in our study, we had incredibly high rates of violence against our trans participants, against everybody, actually men as well, had really unusually high rates of violence exposure. But for our trans men and women and our Native identified women, 85% had experienced sexual assault, 85% in our sample. And in terms of who is committing that violence, 63% was perpetrated by strangers or people who are unknown to them, and as well as 78% had experienced some kind of physical assault, 67% by strangers. See, this TwoSpirit people are at incredibly high risk for violence. And so this is something we need to look at also in the MMIP movement as well. So I wanted to kind of just tag onto that. And Kori, I appreciate your talk about conversion therapies and some of these issues. What can we do? What are some of the kind of low-hanging fruits and opportunities at the tribal level and policy levels that we can really address through law and other kinds of issues? Certainly getting our communities back up to speed with respect to APA standards, American Psychological Association standards around not having conversion therapy. The other issue is the flip side is also getting access to resources and support for ongoing health and wellness supports. Our community has fairly high levels of physical health issues, not just mental health issues that we're addressing, and we need some support around that and issues around housing, especially for our elder TwoSpirit people. How are they connected to communities and how are they getting access to housing and supports that they need in place? I would say that that's another area that needs to be considered. And culture is medicine. You know, building interventions and health promotion interventions, building on the strengths of our community and our culture, I think is a really a great opportunity. There are a lot of local Native Two-Spirit organizations around the country that I think could use some support and help with continuing to do the work that they're doing to have safe places for Two-Spirit people to gather, opportunities for connecting in drug-free and culture-centered spaces, and that needs to continue to grow. And then finally, medical care and access to medicines, as well as for those who are needing access to tea and other kinds of things. You know, we need to create safer places and talk to Indian Health Service and other organizations about, you know, how can we make some of these things accessible to our community members in safe and helpful ways. So, yeah, okay.
Thank you, thank you. I'm gonna turn it to Kori and then Somah, maybe a couple of brief notes on some other things that you think we need to be highlighting and that are missing. And then we do have some audience questions, so we can get to those. And if you want to add more comments within the question response time, that'd be great too. Kori, I'll start with you. Back to you.
Thanks. I will keep it very brief. You know, I echo a lot of what Dr. Walters said, but in terms of the data in my day job at the Yurok tribe, having tribal specific data is incredibly important. A lot of the work that folks are trying to do, address some of these harms that we see in the data. It's really hard if you don't know where your people are. So getting tribal specific data to like properly capture what the problem might be, so you can get resources, get the funding you need, and then, you know, find the folks is really, really important. And then I think in terms of just research and learning more, even if you can't get down to the nuance of each specific, I mean, within that, it's kind of fraught because there's federally recognized tribe, 500 and I think 77 federally recognized tribes right now. California has 106 or 107, but if you include quote unquote state recognized tribes, that number goes up to about 170. I'm sure there are other tribes that are excluded and other Native people that are so it kind of can get fraught, but I think at least attempting to get that very granular data will be incredibly helpful on the ground for tribes. But then also some regional data would be really helpful as well, because my understanding and my experience has been that working with tribes, their contact stories, their contact with colonialism has a huge impact on the style of social issues that they're now having to deal with. So, and the further sort of west you go, the more, the worse it is. And by the time you get over to, so you know, like Native Hawaiian, there was like a totally different genocidal project that happened there so that would be, I think regional data could sort of help, and you can kind of get a sense of, okay, maybe this region had contact with this boarding schools, this region had contact with Spanish, this region had contact with, you know, other Western European, et cetera. And you can sort of, I think, maybe get to some of the missing points in terms of education on the local level. A lot of my experience has been, especially in the West Coast, there's just this big absence of cultural information. And as some folks are doing the work for their communities to try to figure out, no, actually we had a different concept of gender, or we had different concepts of marriage, et cetera, and reclaiming some of that information, that has been really helpful. And I think the most helpful for kids, having that sense of belonging and feeling connected to culture. So I think those would be my two sort of critiques. And I think the more we can get that granular data, the better it'll be.
Yeah, agreed. Thank you, Kori. And Somah, I'll end with you if you want to provide just a comment or two.
Yeah, definitely. I think, yeah, reflecting on what Karina and Kori said also, well, originally in the slideshow, reading that sources, it says sources for Indigenous data that include sexual and gender diversity are difficult to find. And like, that's, you know, unfortunately not surprising. So I think, and like you mentioned earlier, Bianca, too, as Indigenous people, many of our ancestors were stripped of their identities and forced to assimilate in a variety of ways. I myself am the great grandchild of 2 boarding school survivors. So as an effect of this, there's a general distrust of data collectors, I think, even for things like the government census that will supposedly benefit us. When we're told generation after generation to conceal who we are, how are we supposed to react when folks genuinely want to collect data with the intention of supporting us? And sometimes I think the need for self-preservation can prevent folks from wanting to share their full identities, especially with people that they don't know. So also, as we saw in the data, a lot of it is divided into men and women because we live in this society where the gender binary only gives us two options. Of course, we're going to lose data when we expect folks to just pick one, or even worse, if we choose for them based on our own perceptions. I feel like every time I fill out a form at a doctor's office or wherever, it is never an accurate representation of who I actually am as a person. Non-binary, gender non-conforming, and two-spirit folks constantly have to put themselves into boxes that don't accurately represent them. So we definitely need to leave more room for nuance in the conversation. I think that this is also reflective of how, it just reminded me of how a lot of non-Native people view Native folks through this like pan-Indian lens. Like you were saying, Kori, I think tribal specific data would be really beneficial because we're all so different, you know, like and we live across like such a broad space. So like, sorry, I lost my place. Yeah, we're not interchangeable, and we're not all the same. Recently, like living in New York has been a really interesting experience for me because I've been told often that I'm the first Native person that someone is meeting. I told someone I was Indigenous and they were like, "Oh, are you Sioux?" And I'm like, there are 574 like federally recognized tribes, and you're like putting me in this little box because that's the one tribe you're familiar with. Like it just felt immediately like I was being like reduced to what this person's idea of an Indian was. So similarly, I think that LGBTQ folks, especially the trans community, are often lumped together as one label when the gender spectrum is so much more vast than that. So, and folks outside of the binary experience their gender in an infinite number of ways. And like Karina said, I think that's a really good way to describe the term two-spirit. Like it's a placeholder, right? I don't personally identify that way, but like other folks see me that way. But it's you know, it's that term was created like in the 90s, right? We're just like desperately trying to find ways to identify ourselves and, you know, find community with each other. So I think it may be impossible to gather data in this like very specific intersectional community that has so much variety, but I think that we can still expand the way in which we choose to categorize people or ask the questions in the first place.
Yeah, absolutely agree. I mean, I think that's a strong theme in all three of your comments that I definitely share, is just the challenge, well, and the limitations of the way the questions are asked around American Indian identities and the process of racializing a group that really represents multiple sovereign nations, the conflating of political and racial identities as cultural and ethnic. So, you know, and reflecting that, I saw one of the questions from Dr. Randall Key was also about sampling and potential bias, like with a poll, like the Gallup poll, and limitations around like the reliance on cell phone and landline type of sampling, which, you know, work like Karina's attempted to address. I see one question there, but Kori, it looks like do you have a comment?
Yeah, just something I wanted to throw out there. I don't know how it would work or if it would work, but I would be really curious to have a data point in any of this research that also asks the question of how people are racialized. I think what people expect or view Native people to be or to look like it really does impact the types of interactions we have. And there's some things that you can't change, but in terms of like interpersonal violence and those kinds of things, I do think how we're racialized would probably a factor, and I'd be really curious to see. It's something that my spouse is also Native, but can pass as white, and kind of the difference of experience we can have in the same context is very interesting.
Absolutely. I mean, I'd say we could talk after and talk about that next project, just the general limitations of how we measure really all racialized identities and how they serve as a proxy for assumptions about how people see us in the world and treat us. And can we both, yes, it tracks real disparities. At the same time, it's clearly not the whole story when we approach the measurement that way. I know we only have a couple more minutes. I want to ask one question. I did see it was posed to Karina, but anyone can respond, you know, given the current case before the Supreme Court and the potential for the overturn of the Indian Child Welfare Act, ICWA. And the question was, you know, do you work with any LGBT parents? And if so, are you concerned about the implications of that case? And knowing that the implications of the case are both like very specific to the trauma and experiences of children engaging with the child welfare system, but also, you know, other implications related to tribal sovereignty, that case is challenging. But I don't know if anyone wants to comment on that current case or general concerns to threats to ICWA.
I'm not familiar specifically with that case right now, so I don't know enough about it to really kind of feel like confident in commenting on it, the specifics. But I could tell you that, you know, ICWA, we need ICWA, and at the same time, ICWA has not produced what it needs to do at the same time. So we need both. And so certainly any danger in that direction, anything that's going to impact tribal sovereignty is obviously something we don't, you know, I personally think we should not have, and we need to have as much opportunity to address that. But the other underlying question is really to address, why do we still have such a high rate of children placed in out-of-home care? We still have some of the highest rates of the highest disproportionality from any other racial or ethnic or, you know, political identity group, however we want to describe it. So that needs to be addressed. I do think there's something to be said about having LGBTQ Two-Spirit homes that are available to, especially for our LGBT Two-Spirit youth who are in out-of-home care and out-of-home placement, that we need to create environments and safe places for youth to be able, and children to be able to go and be in. At the same time, you know, I worry about states. My partner and I didn't travel to certain areas of the country for a while when my child was very young, before she could speak to her own experience and be old enough, because I was afraid, what if we got in a car accident and I'm not the biological mom, and this is an environment where they don't recognize second parent adoption. Will my child be taken from me? I mean, that's the kind of stuff I had to think about in terms of traveling. So I didn't even go back home for quite a while to Oklahoma, in part with my child, who needs to be in culture and space, but I didn't go back because of the safety issues until she was old enough to be able to say, this is my mom, and we can make an argument of there. But it's that kind of everyday fear that we have to live with, that, you know, the state is going to once again interrupt and disrupt and take in our lives. So that's very real for our community. So. And others might have more specific answers to the actual case. I defer to them.
Okay.
No, this round of ICWA, I have not been in the Bracking v. Holland stuff since I think last April, but I will say it is an issue that is of paramount importance to all tribes. And it's one of the few issues, perhaps the only one that I know of, where every tribe will come to and agree that ICWA is incredibly important and must be defended and strengthened.
Well, thank you very much. With that, I will end. This was an excellent and engaging conversation. I appreciate your willingness to, be critical of what data are available now and how we need to think differently. And with that, I will say goodbye and thank you for everyone who joined us. There were a number of questions. Sorry, we couldn't get to everything, but thank you for joining us today.
Thank you. Bye.